You've heard of Ozempic. Maybe you know someone taking it for weight loss. Maybe you've seen the headlines about celebrities using it, shortages at pharmacies, debates about whether it's cheating. But here's what the headlines have almost completely missed. A landmark study published just weeks ago, following nearly 95,000 people, has found that Ozempic doesn't just change your body, it changes your brain. And what it's doing inside your brain is something that has genuinely shocked researchers, including the scientists who ran the study themselves. People taking semaglutide, the active ingredient in Ozempic, showed a 44% lower risk of worsening depression, a 38% lower risk of worsening anxiety, and a 47% lower risk of addiction. Those are not small numbers. Those are the kinds of results that change how medicine thinks about a drug entirely. I'm going to break down exactly what this study found, why it's happening inside your brain, and what it means for the future of mental health treatment, starting right now. Before we get into the mental health data, let's make sure we're on the same page about what Ozempic actually is, because understanding the drug is the key to understanding why these results make sense. Ozempic is a brand name for a drug called semaglutide. It belongs to a class of medications called GLP-1 receptor agonists. GLP-1 stands for glucagon-like peptide 1, which is a hormone your own body produces naturally, mainly in your gut after you eat. Here's what GLP-1 normally does. When you finish a meal, your gut releases GLP-1 into your bloodstream. It travels to your pancreas, stimulates insulin release, lowers your blood sugar, and then travels to your brain, specifically the hypothalamus, and says, "You're full, stop eating." Semaglutide mimics this hormone powerfully. It binds to the same GLP-1 receptors throughout your body, but it stays active far longer than the natural version. The result is that people feel fuller for longer, eat less, lose weight, and keep their blood sugar under control. Ozempic was originally approved for type 2 diabetes management in 2017. Wegovy, a higher dose version of the same molecule, was approved for obesity in 2021. Since then, both have become among the most talked about medications in the world. But here's what nobody fully anticipated. GLP-1 receptors aren't just in your gut and your pancreas, they're in your brain, scattered throughout regions that control mood, motivation, reward, and emotional regulation. And that, as we're now discovering, changes everything. Now let's talk about the research that triggered this video. In March 2026, a study was published in the Lancet Psychiatry, one of the most respected medical journals in the world. It was led by researchers from the Karolinska Institutet in Sweden, and it followed nearly 95,000 people across more than a decade of data from Swedish national health registries. Every single participant had two things in common. They all had either diabetes or obesity. And they all had a diagnosed mental health condition, either depression or anxiety. The researchers divided these participants into groups based on whether they were taking GLP-1 drugs, particularly semaglutide, and compared mental health outcomes during periods when individuals were on the medication versus periods when they were not. What they found was striking. Those taking semaglutide were 44% less likely to experience worsening depression, 38% less likely to experience worsening anxiety, and 47% less likely to develop worsening addiction problems. But it wasn't just symptoms. The data also showed that semaglutide users were 42% less likely to require psychiatric hospitalization. And they took significantly less sick leave due to mental health conditions. The researchers themselves described these findings as, and I'm quoting directly here, quite strong. Now, this wasn't a small, obscure piece of research that might not replicate. This was nearly 100,000 people, tracked over years, using national healthcare data from one of the most rigorously managed health systems in the world. And it wasn't alone. A separate analysis drawing on records from approximately 4 million patients, conducted by Epic Research, one of the largest healthcare data networks in the United States, found similar results. Semaglutide was associated with meaningful reductions in anxiety and depression diagnoses across the board. We are not talking about one lucky study. We are talking about a pattern emerging across millions of patients. I want to spend a moment on something the study found that has received almost no mainstream attention, and it may be one of the most significant findings of all. Semaglutide was associated with a 47% lower risk of worsening addiction disorders. Alcohol, substances, compulsive behaviors. This makes complete neurological sense when you understand the reward pathway. Addiction is, at its core, a hijacking of the dopamine system. Addictive substances flood the nucleus accumbens with dopamine, creating an overwhelming drive to seek more. The normal reward system gets overwhelmed and recalibrated around the addiction. Animal studies have already shown remarkable results. Rats given semaglutide showed significant reductions in cocaine-seeking behavior. Other research found it reduced alcohol consumption and nicotine-related behaviors in animal models. Human clinical data is now beginning to mirror this. Several trials are actively underway examining semaglutide specifically as a treatment for alcohol use disorder. Early results are promising enough that major research institutions, including Harvard Medical School, are funding further investigation. If these results hold in clinical trials, we may be looking at a drug that simultaneously addresses obesity, diabetes, depression, anxiety, and addiction. That would be, without exaggeration, one of the most significant medical developments of the century. Now, and this is important, I need to give you the honest, complete picture. Because this is the human code, and we don't just report the exciting parts, we report all of it. This study was observational. That means researchers tracked people who were already taking semaglutide and compared their mental health outcomes. They did not randomly assign people to take the drug and measure the results under controlled conditions. That distinction matters. Observational studies can show association, meaning two things happening together, but they cannot definitively prove causation. It's possible that people prescribed semaglutide were already in better health overall, had better access to healthcare, or had other factors that also improved their mental health outcomes. And finally, Ozempic is not a mental health medication. It is not approved for depression. It carries its own set of side effects, including nausea, vomiting, and gastrointestinal discomfort. Nobody should begin, stop, or change any medication based on a YouTube video. This is education, not medical advice. If you are dealing with depression or anxiety, please speak with a qualified healthcare professional. So where does this leave us? We are witnessing, in real time, a drug that was developed for one purpose: blood sugar regulation, revealing itself to have far broader effects on human health than anyone initially anticipated. The science now strongly suggests that semaglutide acts on the brain's reward and mood systems in ways that reduce depression, anxiety, and addictive behaviors. The magnitude of the effects, 44%, 38%, 47% reductions, is not trivial. These are clinically meaningful numbers. This is exactly why I started this channel. Medical science is moving faster than most people realize. Studies like this one, published in some of the world's most respected journals, often get buried under celebrity news and social media noise before most people ever hear about them. The human code exists to make sure that doesn't happen. Every week, I translate the most important research coming out of the world's leading medical institutions, Harvard, the NIH, the Karolinska Institutet, into plain language that actually means something to your life and your health. If you found this video useful, and especially if it changed how you think about Ozempic and mental health, please subscribe. It genuinely helps this channel reach more people who deserve to understand the science that affects their lives. And in the comments below, I want to hear from you. Do you know someone taking Ozempic? Have you noticed any changes in mood or mental health, either in yourself or someone close to you? Share your experience. I read every single comment.